Welcome to the Office of Early Childhood's webinar, Do You Hear Me? Do You See Me? Do You Care? Giving voice to Black women's health and maternal health care. We first will begin by giving interpretive instructions. Passing it to you, Diana.
Thank you, Lorna. Buenos días a todos. Mi nombre es Diana Reyes y voy a dar instrucciones sobre cómo acceder a la traducción para esta presentación. En la parte inferior de la pantalla, haga clic en el globo a la derecha con la palabra interpretación debajo. En la ventana que abre, haga clic en SP o español. Los participantes en el canal de idioma escucharán el audio traducido y también el audio original a un volumen más bajo. Deberá presionar silenciar el audio original para que no escuche ningún eco del inglés debajo del español. Deberá seleccionar esta opción al seleccionar el idioma. Gracias.
Thank you so much, and welcome everyone to today's behavioral health webinar. My name is Elena Trueworthy. I'm the Deputy Commissioner at the Connecticut Office of Early Childhood, and it is my pleasure to welcome you here today. And as always, we want to thank you for being here with us, spending time listening and actively engaging in learning together with us. As we know, behavioral health refers to the mental health, the physical health, and the spiritual health of individuals. And so I really think that this webinar, the title of this webinar, really sets the stage for the discussion and the learning that we want to engage in today. So the title is, Do You Hear Me? Do You See Me? Do You Care? Giving voice to Black women's health and maternal health care. You know, we're looking to highlight the importance of the access to and the provision of equitable health care for women, in particular Black and Brown women. And through our behavioral health initiatives, our overall goal is to strengthen and to promote overall wellness within our system and for our children and families, right? Ensuring that they have access to the supports that they need, the resources to have a success in home, in school, in community. And as we know, the adults in children's lives play such a critical role in their healthy development and learning, and that this really starts prenatally. So for some of you, this may be the first time you're hearing this information and data, you know, from this lens of equity. And I ask you to be open-minded, you know, with the information that is being shared, and to really receive it in ways in which we can learn and actively develop our understanding and our knowledge together. So with that, I have the pleasure of introducing our keynote speaker. Ayesha Clarke is a Connecticut, Hartford native and is a dedicated advocate known for amplifying underrepresented voices in her community. With a master's degree in social work and public health, she focuses on policy and advocacy in health, criminal justice, and education. Ayesha serves on various commissions and boards, including the Community Health Resource and Commission on Race, Equity, and Public Health for Connecticut. As Executive Director of Health Equity Solutions, she works to ensure equitable healthcare access regardless of race or socioeconomic status. Ayesha is involved in community organizations such as the Citadel of Love and the NAACP. Alongside her professional commitments, she finds joy in family time, travel, movies, and dancing. Ayesha, we really thank you for being here and really look forward to your keynote speak. Thank you.
Thank you so much, Deputy Commissioner. And thank you to everyone who's involved in the committee and the Connecticut Office of Early Childhood. It is an honor and a privilege to be here today. And to all of you who are joining, happy Minority Health Month. So as we talk about and discuss, as you've heard, Health Equity Solutions is a statewide nonprofit organization where our mission is committed to addressing health equity through anti-racist policies and practices. Really, our vision is that every Connecticut resident is able to obtain their optimal health regardless of their race, ethnicity, and socioeconomic status. The theme that, as you heard, is do you hear and do you see? And so I'll bring you on a journey when it comes to my own maternal health, where I felt that there was a space where I was not heard or seen. I walked into the hospital and I was what I considered fully dilated. Did not know, but it was my first pregnancy. Walked in pain. However, when I got to the desk, they shared with me, there's no way that you're in pain. There's no way that you're in full labor. Why don't you, go home? We can check you later because you don't seem like you're in pain. So I insisted and shared with them, like, no, I feel like I'm in pain, and my doctor told me to come in. My husband also went to share that this was an opportunity for me to advocate for myself. After we finally talked with the doctors and the nurses to share with them that I should be at the hospital, they finally checked me. When they checked me, they realized that I was almost fully dilated. I share this story in this space just to talk about being seen or being heard. At that moment, I felt small, I felt unheard and unseen. It took for me to advocate for myself, for other individuals to hear my cry. I think about many individuals throughout our state who look like me, who might not have known they had the ability to advocate for themselves. And so throughout my talk today, I will bring you through a few things. And I know that my slides will be shared, but I will bring you through a few things where we really talk about the work that we do at Health Equity Solutions, and then really level setting this idea of what health equity is, defining maternal mortality, and then the role that Health Equity Solutions plays throughout the state, and then ways that you could get involved as well. So as we go to the next two slides, you will see that Health Equity Solutions, we really have a theory of change. And our theory of change is that individuals, the next slide, please, is that we like to educate, agitate, and advocate. What this means is that we understand what people's wants and needs are. We draw insights from their experience and employ research and collaboration to translate the nuanced concepts into tangible policy solutions for people in the state of Connecticut. We can go to the next slide, please. Simply put, we initiate and catalyze policy programs and practices that advance and sustain health equity in the state of Connecticut. In order to get there, again, we have to educate, agitate, and advocate in order to get health equity. We are an organization that offers trainings, engage in community engagement and organizing work, and advocate with other community partners and policy makers at all levels of government. As you'll notice on the next slide, we'll go into detail about what health equity means. Health equity, as stated, is the core of our work. Health equity means to us that everyone has the fair and just opportunity to attain their optimal health, regardless of their race, ethnicity, disability, gender, identity, sexual orientation, socioeconomic status, their geography, and other things. As I just shared in my story, it's the idea of me having the ability to have my health equity. Without health equity, residents don't have the opportunities to be and stay and be healthy. This can have a profound impact. One example would be, without health equity, children underperform in school and thus fail to reach their highest potential. Businesses are rising healthcare costs and reduce productivity from their employees because there is no health equity. And communities and neighborhoods weaken when we don't have access to fresh food and other things. Connecticut is one of the healthiest states in the United States. It has some of the best doctors, hospitals, and it has some of the best health insurance and considered the health insurance capital of the world. The state is often heralded as being one of the healthiest states, yet Connecticut also has some of the greatest health disparities in the United States. As we go look at the next slide, we'll see that there are disparities in maternal outcomes as it relates to racial justice and understanding that this is a racial justice issue. Racial disparities in pregnancies related to deaths show that across all income and education levels, Black women in the United States are at the highest risk for poor outcomes than white counterparts. This is a racial justice issue. Black women often face barriers accessing quality health care, including prenatal care due to systemic racism. And even when Black women do access health care, they may receive lower quality care compared to their white counterparts. This can result in implicit biases held by healthcare providers, leading to misdiagnosis, delayed treatment, or inadequate attention to concern raised by Black patients. Again, I'll bring that back to the story that I shared at the top. This could have been me. Delayed treatment could have happened, or I could have been misdiagnosed of what was happening. Additionally, due to historical and contemporary redlining practices, that pushed Black residents in lower opportunity neighborhoods, Black women were more likely to experience poverty and live in neighborhoods with limited access to resources like healthy food options and safe housing. These social determinants of health contribute to increased health risks during pregnancy and childbirth. Solutions for health equity need to be considered. We need to consider the social, political, and historical context of race and ethnicity in this country. Moving forward, initiatives should focus on addressing systemic racism within the healthcare system, investing into community-based services, and advocating for policies that promote equitable access to resources and opportunities for all individuals, regardless of their race, ethnicity, and socioeconomic status. So let's look at the next slide where we have a quick look at what's happening here in the state of Connecticut. As you can see, this is broken down. As Connecticut is ranked number 10, the top 10, we're the 6th in the state for overall health outcomes. We're the 5th in reproductive care, and we're the 8th in healthcare insurance coverage and access to care. However, members of racial ethnic groups in Connecticut fare far worse in terms of health outcomes. And this is typically geographically stated in the city of Hartford, Waterbury, and parts of New Haven. And unfortunately, it does target, and I won't use the word target, but it is as a result that impacts our Black and Hispanic residents more likely to live in a poorer health because of based on where they live. Also, Black residents are more likely to experience premature death based on just, again, where they live and access to care. As we look in the next slide, HES role in Black maternal health is to really think about and work with others on some changes. Over the next 3 years, we at HES will serve as a co-convener and policy and advocacy expert. We are a part of the Black Maternal Health Initiative in partnership with Ministerial Health Fellowship, Doulas for Connecticut, the Yukon Health Disparities Institute, Bridgeport Prosperous, and Fairfield County's Community Foundation. And the work aims to eliminate systemic racism and implicit bias embedded in the healthcare system that leads to disparate outcomes for Black women in the Fairfield County. The goal is to improve the care for Black mothers and birthing individuals who receive care so that they can have healthier pregnancies and births. We want to make sure that Black mothers and birthing individuals have a happier and healthier childbirth. What does this mean? And thank you for some of you doulas who are here. This means expanding doula care for Black mothers and birthing individuals. This means strengthening local birthing workforce and more doula training and hiring. This means advocating for health systems and legislative changes and prioritizing Black mothers' needs. It means advocating for community-based support networks. It also means educating others on maternal health disparities and effective strategies. So thank you so much for the Office of Childhood Advocacy, because this is an opportunity for this to be highlighted. This is also an opportunity to highlight community partners' efforts for birth equity and systemic change. This is an opportunity if we all work collaboratively and collectively. We can work with hospital systems and also Connecticut State Legislature to integrate doulas, community health workers, and other lay workers into regular models of care. This is important and needed. There's also an opportunity to recruit Black birthing people families, and birth workers to identify the challenges and solutions to hospital-based births. This is also an opportunity to work with local funded partners to recruit directly impacted people to identify the challenges and solutions to the hospital-based births. As many of you know, those who are impacted, who are on the ground, are typically the ones who have the answers to their support, for the support that they need. So making sure that they are a part of identifying the challenges and solutions is needed. And it's also an opportunity for those same individuals to serve as liaisons between community members and then be able to work with hospital staff and legislators. And that is an opportunity to ensure constant channels of communication and establishing rules of engagement in order to really see a change in our maternal health within the state of Connecticut. I wanted to share some of the things that Health Equity Solution has been doing over the last several years. As you will see on the next slide, we are immensely grateful to be a part of this important work as it relates to maternal health. Standing alongside many others and others who are in this room, we make sure that we make purposeful partnerships and share the vision for maternal health equity. At present, we are developing a strategic plan that will guide our efforts over the next few years, outlining clear goals and targets. However, we recognize there are many of us, and that this is a delicate issue as we're talking about maternal health. Any intervention requires careful consideration and thoughtful planning to ensure that our actions are not only effective, but also respectful and inclusive. It's an opportunity for us to ensure that those who have been impacted are a part of the belonging community, that they are included in all steps of the process. We are committed to approaching this project with the utmost care and sensitivity, recognizing the importance of engaging with all relevant community partners to ensure that the plans reflects the diverse needs and perspectives of our community. In the next slides, I will discuss our work and that we're doing here in the state of Connecticut and nationwide. In this, you will see that since our inception, HES has always worked to ensure that mothers and birthing individuals and children get the care they need when they need it. This is very important. As a result, much of our work includes supportive projects, advocating for policies, and working with community members and experts on initiatives that improve health and health well-being. And these are important to hear from the community. Earlier this year, we partnered with the State Health and Value Strategies, also known as SHIVIS, which is funded by the Robert Wood Johnson Foundation, to publish an issue brief on enhancing equity for maternal health providers. These briefs specifically talk about and examine reimbursement patterns for certified nurse midwives, other midwives, and doulas, aiming to ensure payment parity for all maternal health providers. This is important. If we're talking about health inequity and we're talking about how can we shift, it's important that individuals are reimbursed at the right rates. It is also nicely fits into the work here as we're talking about changes in maternal health. As the maternal mortality rate continues to worsen across the United States, we thought it was important to discuss the state of the maternal health workforce. Medicaid covers 2/3 of the birth among Black and Indigenous people in the United States. Currently, more than 50% of the U.S. countries and counties do not have a midwife, and only about 6% of birthing people receive doula care. Again, 6% of birthing people receive doula care. Medicaid reimbursement is potentially a policy lever to encourage the growth of a diverse midwifery and doula workforce. And also, it's an important opportunity to have other individuals understand the importance of having doula care. Currently, right now, there is a primary maternity care and maternity bundle focus group, and it's also a part of social media outreach. Last year, we collaborated with the primary maternity care and Husky Health programs to host 6 focus groups to collect information that supported the design, planning, and successful inclusion of doula care services into the Husky Maternity Bundle program. The focus groups engage with a total of about 72 people and 72 participants, which included physicians, OBs, and midwives who deliver prenatal care, and also postpartum care. We also work with doulas to provide support and information to birthing individuals. This was important to happen before and after birth. We also engage with Husky Health members. As many of you know, that sometimes policies are done without having individuals at the table. On the next slide, you'll find that information about how and why HES believes that policy should be at minimum informed by the people that it impacts. Each year, Health Equity Solutions hosts community conversations to learn what health equity issues are most important to people in the state of Connecticut. To date, we have engaged over 570 participants across 47 Connecticut towns and cities. These conversations are used to develop our yearly policy agendas and other work that we are doing throughout the state. Hence why we are completely focused on maternal health work and other projects. One of our goals this year is to monitor and support the implementation of anti-racist policies and practices. This means ensuring equity-focused policy victories are implemented in a timely fashion and with community input. Specifically, we are monitoring the implementation process of doula certification. Doulas are culturally competent, trained non-medical professionals who provide physical, emotional, and informational support. This can be done virtually and/or in person. It's important to have this individual be a part of the process. These individuals are part of the process, when individuals are pregnant, before, and even during and after birth. The intention of the doula relationship is to tap into and develop a birthing parent's inherent power to make decisions for the well-being of themselves and their families. Currently, the doula certification is still being finalized, and HES is a part of the Doula Training Program Review Committee through the Department of Public Health. One of our main legislative goals this year is to strengthen hospital financial assistance, also known as charity care, to prevent against medical debt. Hospital stays are leading cause of medical debt, and 72% of people with medical debt have debt because of short-term treatments, like one hospital stay or treatments for an accident. Many individuals will skip going to the hospital and/or getting treatment based on this. As we have learned, due to systemic racism, Black Americans are far more likely compared to other racial ethnic groups in the U.S. to have medical debt. Furthermore, women who are most likely to have medical debt are compared to men. A lot of the difference are a result of childbirth expenses. It's important for us to continually work together with individuals here on the call and others. That leads me to the next slide where, what can you do and how could you be involved? It is important to pay attention to how systemic issues such as structural racism impacts individuals, especially our birthing individuals. As you work to improve health, consider all factors that impact health. This could be schooling, education, training, and even schooling. Advocate for systemic change within and outside of institutions. This is within state agencies. This is outside as a community coalition. This also can mean talking and going to your legislators. It's very important to understand that each and every one of you have a voice, and utilizing that voice to see a change could really shift our maternal health outcomes. Advocate for health equity. This is really a redistribution of health resources. This is looking at, are we doing equity work or are we doing equality work? Many individuals feel that equality is enough, but we know, and we're learning more, that equality is not enough. We need to ensure that everyone gets everything they need, especially as I shared at the top of the call, defining health equity. And then fighting for racial justice, doing this in the best way that you can do. I always say, learn who you have voted for. Learn who your local officials are. Learn who your state officials are. These are individuals who are making decisions about our healthcare systems, about our health, and they are the ones who are able to change policies. So you have a voice to really fight and change our racial justice systems. I want to thank again for the opportunity to present here about some of the work that is happening here in the state of Connecticut, and also some of the work that as it pertains to Black maternal health. I want to encourage each and every one of you to take some time to learn more and to learn about some of the amazing organizations that you'll hear on the panelists and across the state of Connecticut that are working for change for individuals as it relates to maternal health. Thank you again, and thank you for your time.
Ayesha, my oh my, it is you who we thank for your powerful message, for your words that shed so much information, but inspiration as well. Thank you very much for keeping it real in terms of the reality of what is happening in our communities now. Thank you, thank you, thank you so much, Ayesha. Wonderful. Now we are going to receive more additional information that is inspiring and informative. We are going to see excerpts of a documentary entitled Eggs Over Easy. Eggs Over Easy is produced by Shaquita Lockley, who is the executive producer and director of the documentary. She is an award-winning producer. She also is a published author, a community activist. She holds a BA from Spelman College and an MA from Emory University. But most importantly, she, similar to Ayesha, is another person who is speaking out for change and trying to have it done in a purposeful way. So at this time, we now will see excerpts of Eggs Over Easy.
Hello, Connecticut. How are you? I am Shaquita Lockley, filmmaker of the documentary Eggs Over Easy, Black Women and Fertility, as seen on the Oprah Winfrey Network, Discovery Plus, and Delta Airlines. If you are flying the skies this month, you'll be able to find us there. A lot of times, and historically, we don't feel like and haven't felt like we were heard, that we were seen, or that really anybody cared about our health issues, particularly our reproductive health issues and concerns. And that is why I set out to make the film, to kind of amplify our voices, to shine a light on problems that we are facing, to make sure that somebody sees us, to make sure that somebody listens to us, and to give us the words to go back into our doctor's offices to explain what it is that we need, what it is that is the problem, just to make sure we're comfortable enough when we are having these conversations, to make sure that when we're at home for Thanksgiving, it's not a tough conversation to have, but it's an easy one to have with our family, with our moms, with our aunts, with our nieces, our daughters, just to put our reproductive health care in the center of conversation in a way that is safe. So that was the goal with the film. I hope that you enjoyed the clips of it you are about to watch, and I hope one of your takeaways is self-advocacy, to make sure that you're speaking up for yourself. If something doesn't feel right, tell somebody. If you tell the doctor and they don't listen to you, find another doctor. We are in control of what happens to our bodies, for better or worse. We are in control of it. So we have to make sure that we are advocating for ourselves. Without further ado, I introduce you to clips from my film, Eggs Over Easy, Black Women and Fertility.
Every day across the country, some woman is being asked the intrusive question of, when are you starting a family? Girl, you know you're getting older. When are you having a baby?
So the optimal time for a woman to try and get pregnant is during her 20s and 30s. But that is also the time when a professional woman, is either peaking in their career or still pursuing their career.
Being an advanced maternal age patient, or AMA, an older pregnant lady, and having a career could create definite challenges and obstacles when you have so many doctor's appointments and tests that you have to go to.
When I made the decision to not have kids, I was 43. It was a 13-year process. Yes, emotionally, it was draining, because I would still go through periods of depression, or I would say, maybe I can stretch it out. Maybe I can go to 44, maybe I can go to 45.
African American women are 4 to 5 times more likely to develop fibroids than any other race and lead the world in hysterectomies.
You know, after my first myomectomy, our fertility specialist insisted that we'd be able to get pregnant like that. She felt like it was going to be an on switch. And, after I recovered, things weren't happening.
We don't talk about the shame that we feel associated around stillbirths or miscarriages, because there's this persona that as Black women, we should be able to do everything.
And you get pregnant and then you lose your baby. I mean, whose fault is it except for mine? So you start to believe that, like, I'm a failure.
Technology may have to help some of us, but there's nothing embarrassing or shameful about that.
Speaking with patients that have the difficulties with getting pregnant or experience it yourself, you don't really know how hurtful those jokes can be.
Yes, thank you, Shaquita. Thank you, Shaquita, and all of those voices in that documentary. And let us continue with the conversation. Let us continue with hearing the voices as we now will have a panel discussion with some wonderful, phenomenal participants to help continue to share words of wisdom. We first have part of our panel discussion, Dr. Lenore Williams. Dr. Williams is a board-certified physician with over 25 years of experience in private practice, providing comprehensive, individualized OBGYN care to diverse populations of patients. She currently works at UConn Health Center and is an assistant professor of obstetrics and gynecology. Additionally, she is a North American Menopausal Society certified menopause practitioner. Dr. Lenore, we just have you to say hello so the screen can feature you for a moment.
Hi.
All right. Thank you so much, Dr. Williams. Next, we have Dr. Carla Gunn-Sampson. Dr. Gunn-Sampson is a board-certified physician with over 16 years of experience in obstetrics and gynecology. After years working in the hospital sector, she opened her own practice and is the owner and medical director of Hibiscus and Honey Medical and Aesthetics, LLC, where they seek to promote self-care, confidence, and self-love. Dr. Carla, may you say hello so we can feature you? But you're on mute.
Of course I am.
All right. Thank you so much, Dr. Carla. Next, we have Marva Malone-Lyles. Marva is a member of the Greater Alliance of Black Social Workers and has a private practice called The Wellness Factor, LLC, located in Hartford, Connecticut. Featured in psychologytoday.com, she provides clinical services to the needs of the PIPPC community and specializes in trauma, anxiety, depression, PTSD, and mood disorders. Marva, may you please say hello?
Hello, and thank you for having me.
Thank you for being with us. Next, we have Dr. Cheryl Ellis. Dr. Ellis currently works as a director of DEI and for DDS, Department of Developmental Services, after working several years for DEMIS as the clinical director of the Waterbury-led Mental Health Authority. Prior to DEMIS, Dr. Ellis worked for about over 20 years in nonprofit agencies with school-aged children, teens, young adults, and pregnant mothers and exposed infants. Dr. Ellis, may you please say hello?
Hello, everyone.
Thank you so much. And next, we have Jennifer Wilder. Jennifer works at the Office of Early Childhood as a primary prevention services coordinator. She has been instrumental in bringing the work of doulas into the agency. As a result, partnerships have been established, having a long-lasting impact, providing maternal health care and supports throughout the state of Connecticut. Jennifer is also a published author, community advocate, and proud mother of two. Jennifer, may you please say hello?
Good afternoon, everyone.
Wonderful. Thank you so much. Thank all of you for joining us today. And let us begin our conversation. This question is for all of you to please respond to. Please tell us what brought you into the field of the work you do. What brought you into the field of the work you do? And we'll start with you, Jennifer, please.
Awesome. So I think I was led to work with and for people, but I stayed in the position at the Office of Early Childhood because I'm able to lean into programming that really speaks to my core. So we're shaking up some systems, right? Illuminating the natural intersection between like doula work and home visiting system. And so that's the easy part, right? So a passionate home visitor, a driven doula that I met at a statewide meeting, a workshop at a national convention added to my ability to make a strong proposal for this work. But then also my sister, who's a chemist, and her husband, who's a PhD, their story of my sister almost losing her life after giving birth to her youngest child really, solidified the need to bring doulas to this work. And so several years back, we were able to start introducing doula services through a pilot program with our Teen Preventing Pregnant Teens program, SPPT, pre-pandemic, right? And so we hired a doula who, two doulas, in fact, that were home visitors who stepped into the world of doula work to be consultants and supports for our teen parents. And that was such a great pilot that, given the opportunity for doing doula work, with PDG funding and also an upcoming RFP. We integrated it into those two things. So, and then seeing how well it did, we brought it into the one and only women's prison, which is great work that I won't take too much time, but and my counterpart, Liz Rivera, who's really been instrumental in bringing the services to the prison here in the state of Connecticut, is doing some inspiring and groundbreaking work, supporting moms in a place, in a space where they are definitely not heard. And so really excited about that work. And it was those factors that brought me to it and then actually kept me here.
Thank you, Jennifer, and we're glad that you were inspired and you have used your inspiration in a productive way. Thank you. Dr. Carla, may you please share?
Yes, let's make sure I'm not on mute. Okay, perfect. I think that I came to the space of just women's healthcare and becoming a physician sort of early on in life. I always knew that I wanted to pursue a career in medicine. And then I found women's health. And I think that I really felt like those were my people, if that makes sense, right? Like I was in a sort of had this inherent skill to be able to be a good listener, communicator, understanding women. So I felt like this was a space where I could really make a change, not only in health, but in care, which are two different things, because you really have to be a good listener and understand people where they are in their space. And women have like an amazing sort of diverse, wide array of life, right? I guess all people do, but women are special that way, right? We are caregivers in different spaces. Sometimes we are moms, sometimes we are sisters, daughters, workers. We show up in a lot of spaces, and that impacts how we are cared for and the kind of care that we need, right? And so each person is an individual. They need to be listened to so you know where they're coming from, and that impacts how you can care for them. So I really felt like that was a great space for me. It turns out I also needed to be in a space that was good for me as a woman. And so I did a pivot and I sort of pulled back on the private practice of healthcare in that space of just being an obstetrician gynecologist, started my own business, but I still utilize those same skills when now I have all the time to talk to people and really understand where they're coming from and what their needs are. And I hope to continue to do that. But that is sort of what led me into women's health specifically versus, a different area of medicine and how I got to where I am right now.
Thank you so much, Carla. I'm glad you had that journey. We're all benefiting from that. Thank you. Dr. Cheryl.
Hi. It's interesting to hear how people came into the field. I started really young thinking I want to be a doctor. My family would ask me, what do you want to be when you grow up? And at 7, I said a doctor. Wasn't sure what that meant at 7. Got to college, went to an all-women's college, and took organic chemistry and figured the kind of doctor I wanted to be did not require organic chemistry. So I took a couple of psychology courses and fell in love with just the social behavioral, the understanding of human nature, how people behave, why they behave a certain way, and really moved into the desire to continue to work with children and want to help people. And in a field that didn't have a lot of people that looked like me, I was oftentimes the only one around the table, and realized that the stigma in our community, in the Black and Brown community around mental health, and having someone who looks like you talk about it, normalize it, help people understand what it is, was what I wanted to do. And I started working with children who experienced trauma and out-of-home placement because unfortunately, we are placed out of homes at a disproportionate level. And so really trying to help families reunite, help families understand the system, helping children to reform those broken attachments, and decided that's what I wanted to do, and ultimately led to working with moms who experienced substance use and had infants who had been exposed in utero. and just working with educating and supporting families around how the stigma, the system, their health and their child's health was impacted by, these conglomerate of things that they encounter in their lives. And that's where I stayed until about 2 years ago, where I decided diversity, equity, inclusion, making policy changes, creating environments that were more inclusive was the next step in my journey. And so that is where I am today. And that part of my journey, really looking at system change and policy change and creating environments where we are at the table, where we, letting people know we do belong at that table and our voices need to be heard, because no one's going to advocate for us like us.
Absolutely. Thank you so very much. Thank you. Marva, may you please share?
Thank you very much. And just to go along with Dr. Cheryl, she said the spirit of advocacy. And I think I was born into that role to kind of give people a voice and help them to be seen when they're not seen. And so being a part of the Greater Hartford Alliance of Black Social Workers, I think it's just my core to be able to find help and have that advocacy for people to kind of be independent and to claim their voice and their seat at the table. And the way I got here was just the common love of our people. I'm a strong proponent of providing courage and healing to those who are hurting the most. And as a mother of three, I've also shared not being seen, not being heard, and being a mature, older person having a child came with a lot of challenges. And so to be able to now say to moms that you do have a voice and you need to sit at the table, you need to tell your story, and having representatives in the state of Connecticut who don't necessarily look like you, but don't represent you. But knowing that 3 representatives out of 5 supported the Black Maternal Health Momnibus Bill, which is spearheaded to help lessen the divide of the racial disparity among Brown and Black birthing persons and mothers. And so not knowing that your constituents are suffering and not seeing that and not hearing that, we do need to come together in this collaborative effort to work together. So it's beautiful to see physicians, doula, educators, people in mental health to be able to bring more voice to those who cannot speak for themselves. So I really am really excited to hear more about what the panelists will bring, as well as the community that's watching this. So I'm just very excited. And in the spirit of advocacy, I think we need to go and command our seat and be heard and seen, because that's the only way legislation is going to change, for you to be able to demand your voice and to be seen and heard.
Absolutely. We all need to grab our seats at the table. Thank you so much, Marva. Dr. Lenora.
Thank you for having me as well. So my journey began when I was growing up in New York, in the Bronx. My mother was a nurse at Harlem Hospital, and my sister was a labor and delivery nurse at Jacobi Hospital. And I started to be interested in medicine because I thought that was going to be something that was rigorous and challenging, and it was, still is. I decided to do OBGYN because I wanted a specialty that would allow me to have a continuous relationship with my patients. Also, I wanted a specialty that was exciting and invigorating, which obstetrics and gynecology is. Sometimes it can be too exciting, and often when that happens, it's not very pleasant. I also enjoy doing surgery and procedures. To this day, I have been in practice now. I'm in my 35th year. 27 years of those was owning and running my own very busy private practice. I'm currently at UConn Health, which takes away some of the pressures and allows me to do more of the non-physician in a hamster wheel type medicine, so that I take the time to talk and listen to my patients and delve into what their needs are. I still maintain relationships with patients that have been my patients for 34 years. Some of my best friends are women who initially came for their OBGYN care, and we remained close. Some patients, I am now on the 4th generation, and one of the greatest honors and privilege for me is when I have a patient who brings her daughter to see me or her granddaughter to see me. Additionally, the ability, especially now here at UConn, to serve as a role model and to assist those other medical students, mostly women, who look like me in their journey through medical school, through environments that sometimes are very hostile. I welcome the opportunity to not only educate, but to empower and be somewhat of an inspiration to them. I share my story about starting medical school when I had a 4-year-old. I share my story about having my second child during my 2nd and 3rd year of residency. And I do that just to let them know that, it can be done and you can do it. So I do it more for other folks than I do it for me. Having been an obstetrician gynecologist, there's something very special about being a part of assisting a woman bringing life into this world.
Special indeed, and we're so thankful to you for being a part of that, and Dr. Carla as well in your role. And quite timely, because the next question is specifically to you, Dr. Lenora and Dr. Carla. What are the top health conditions impacting Black women compared to other racial and ethnic groups? Again, what are the top health conditions impacting Black women compared to other racial and ethnic groups? And whomever would like to go first.
Okay, that means I'll go first. So I would say that's sort of like a twofold question, right? So the top health concerns for all women are sort of, in my opinion, the same, right? There are specific conditions that affect mortality. We talk about, cardiovascular health in relation to hypertensive disorders in pregnancy, bleeding or hemorrhage disorders, right? These are the top causes for mortality and infection, but those are all things that impact all people, right? And so for me, the question is, well, why do these things that are elements to healthcare, obstetric care, for all people impact Black and brown people more, right? Is it not really the health conditions themselves? Although sometimes Black and brown women come with risk factors that maybe their counterparts don't have as much, right? But does that mean that the care is any different? Does that mean that the outcome should be any different because we have specific risk factors? All people have risk factors, right? Mine may be different than yours. But then on the alternative hand, there is something very inherent about the way we care for people in this country that is based on the foundation of the healthcare, how we teach our healthcare professionals, and why that is systemically different for Black and brown women than other women. So it is not for me that the existence of the health condition that changes anything. It's how we address it and how we're looking at the system of healthcare, whether it be the hospital system, the professionals that care for women, insurance. All of these things are impacting how Black and brown women are treated. And I also would say there is some element of the foundation of healthcare that is built on not listening to women of color, not just to, go along with the theme, not hearing women of color, not seeing them, and why this is, like why it is that we cannot see all people for who they are and treat them equally. And there is something very specific about the system of medicine, again, and how we teach our medical professionals and how we cannot seem to come together and see all people for who they are. So I guess I didn't really answer the question, but all of those health conditions, right, are true in the setting of women's healthcare and obstetrics and gynecology, but we really do, and that's what's happening here. And what makes it so amazing is that we are trying to address those systemic differences and make sure that everybody is cared for equally and our outcomes are equal.
Thank you. And you answered it quite well and you brought us deep. And we're going to hear Dr. Lenore, who's going to continue with getting deep with us.
Yes, you did. Yes, you did, Carla. I think one of the main things is stress. Stress impacts how severe your heart disease is going to be. Stress impacts how severe, how you may heal if you're diagnosed with breast cancer. Stress may be related to how you're able to manage your diabetes. So I think stress plays an important role in the healthcare, particularly of Black women. It is absolutely exhausting to be a Black woman in the United States of America. And that stress and exhaustion ages us more quickly so that we are unable to heal ourselves in the same way that other people are able to who don't experience those stressors. And those stressors are due to the systemic and structural racism that we exist in. Typically, we do not have access to the best resourced schools. Many of the neighborhoods we live in are food deserts. We often will live in neighborhoods that are next to landfills or highways, and so we are exposed to pollution more so than others. So it's not so much that we are so different that that we get these health issues, but the deck is stacked against us from the day we are born here in the United States of America.
And deep you continue to bring us, Dr. Lenora. Thank you, thank you, thank you so much for that. And we're going to continue in this vein with the next question that is for Cheryl and Marva. Recognizing there is a connection between one's physical health and mental health, what are some symptoms you may describe seeing when physical health impacts mental health? Again, recognizing there is a connection between one's physical health and mental health, and we just heard much of that from Dr. Carla and Dr. Lenora. What are some symptoms you may describe seeing when physical health impacts mental health? Whomever would like to go first.
Well, I can start. Just in terms of mental health and the mind-body connection, stress, as Dr. Lenora mentioned and Dr. Carla mentioned, is a significant role in mental health as well. And it may manifest or it may come across as depression, anxiety. And unfortunately, in our system as women of color, it it's often dismissed. We're to present stronger, we're to present more capable. And sometimes we can't take that step back and say, I don't feel right. I'm depressed. I want to just sit and cry. And in the documentary, the one of the women mentions just even the loss of her child and that sense of being a failure and coming in the, into this depression. And what do we do with that? And in mental health, it sometimes comes out as substance use. Sometimes it comes out as just overworking and becoming overengaged and disengaged. It can also manifest in kind of disorganized thinking. So there's just so many ways it can show up that we as women sometimes will ignore because we're told we just need to keep moving. There's so many other people that we need to take care of, that we need to just, as they say, put on a big girl and keep moving. And so we don't have an opportunity to process that. And so it can show up as trauma as well. And gendered racism is a real thing. That intersectionality of being a woman and being Black is real. And we carry that trauma through generations. It's not just our trauma that we carry our grandmother's trauma, we carry our great grandmother's trauma. And that's a lot to hold on to. And so our mental health is oftentimes significantly impacted and can show up just so many different ways.
Thank you, Dr. Cheryl. Marva.
Yes, Dr. Cheryl, you're absolutely right. Sometimes a child is born with prenatal trauma, and the importance of the mom being able to recognize and trying to combat the stress, depression, anxiety, and can lead to suicidal ideations or thoughts. And these symptoms can lead to higher rates of morbidity for birthing persons and women who are pregnant and prenatal. The care that we see now may be better than previous years, but Black and brown women are still dying at higher rates than their white counterparts. And in terms of prenatal mood disorder and mental health issues, if a mom is already suffering from substance abuse, mental health disorders, anxiety, and depression, it's going to be exacerbated during her pregnancy. The medical ailments and the physical part of being pregnant and delivering a child can definitely impact your mental state. And then the fact that it's 40% of Black and brown women may experience more so that. So they're being predisposed with discrimination, implicit bias, microaggression, stigmatism from not being able to express how they feel can combat that anxiety or depression, especially when you're not being heard. Going to a doctor and saying, I'm in pain, and then they discount that. But of not having the voice of advocacy, you wouldn't be able to be heard and seen. But it is very important as the Black and Brown community embrace mental health and be more aware that there is help out there, that we do have to sit and talk with our family and have the conversation about reproductive health. And it's only, again, with our spirit of advocacy that we can make changes in legislation. But if you do not have a voice or you don't feel that you're heard, it's very difficult. And I am really saddened to see that disparity continues to exist throughout this time for Black and Brown women.
Thank you, Marva. Yes, it is unfortunate unless we do something about it. And having these conversations certainly is an important piece to that. And so with the insight that you and Dr. Cheryl have shared in terms of the impact, we also want to look at it broader as well. And this next question is for Jennifer. When you think of the many layers defining women's existence, and we heard much of that thus far in our discussion, what challenges are present in communities that are what challenges are present in communities that disproportionately impact Black and Brown women? I'll read it once again. When you think of the many layers defining women's existence, what challenges are present in communities that disproportionately impact Black and Brown women?
Well, we heard a theme, and hopefully you guys can hear me. I was told to lean in just a little bit so you can hear me. So is the volume good? Can you hear me well? Awesome sauce. And so you heard from, and there's a theme, right? It's hard to be a woman alone, but even harder to be a Black woman. And so when thinking about this question, I was reminded by America Fiera's iconic Barbie speech. I don't know if you guys saw the movie, but if you didn't, you can go on YouTube and type in America Fiera's iconic Barbie speech. And in that speech, she talks about the contradictory role of being a woman, right? How hard it is to be a woman. In that speech, she talks about having to be extraordinary. She talks about having to be thin, but not saying you want to be thin, but you want to be healthy, right? It talks about being a boss, but not being mean. What does that mean? And so you compound that by being a woman with some melanation in your skin, and being a boss and not being mean or being, passionate about your words can make you sound like, or people think that you are an angry Black woman. And sometimes we are angry Black women, but we have to hold our mules and have to keep it cute when we're in public spaces. But it makes it really difficult to show up in our skin, right? And so it's that perception of our strength that contributes to how systems treat us, right? We heard in our keynote speaker share her experience, her birth experience, not being seen, not being heard, when she walked into the emergency room to give birth. And so, I don't want to lean into all of the things that are that hold us back, but lean into a new rebranding. And so what I'm doing is I'm living soft life, right? Going into 2024, I am, putting on my queen crown, and I am asking for help. And I offer other women to ask for help, because we talk about our strength, because we have to be. I don't want to be strong all the time. And so I offer this to everyone who thinks of women of color, and you think about all the disparities, and what you do is you help them to live a softer life. You ask them if they need help. You ask them how they're doing. You ask if they need some supports, because some of our strongest providers, some of our strongest co-workers, some of our strongest friends and family members are the ones that actually need the most help. So I kind of want to lean into that and offer that in response to this question. You guys will have that.
We will certainly have that. And well said. Well said. Thank you, Jennifer. And with that, this next question is for all of you. And one thing I just want to say, and I told you all already, be prepared for spontaneous pieces, but I want to say that I greatly appreciate and respect all of you for the candid way in which you are responding to these questions. And also want to say respect very much so how it may elicit some vulnerability in responding to this question. So I'm speaking to the panelists, but I'm also speaking to those that are viewing this webinar as well. We're having some pretty deep talk right now, and we're disclosing and sharing some things that are pretty intimate for many women in general, but in particular women of color. So we're thankful for all of you that are watching and listening to this and hoping that you are receiving the information attentively and with care, because it's not easy to speak at this level of intimacy in terms of emotions, in terms of things that have been experienced. And to all of you on this panel, I thank you so much for being a part of this and sharing these messages. And so with that, this question is for all of you. What are your thoughts regarding some who may question why comparisons between races are made and instead encourage focusing on appropriate health care for all? Again, what may your thoughts be for some who may question why are we doing all of this comparison, talking about Black and Brown women compared to and why it's impacting Black and Brown women more, and who may say, well, we just need to talk about health care for all. What may your thoughts be to those that may think in that way? And I'm going to start with you, Marva, please.
Thank you. I was going to volunteer to speak anyway. When I look at the statistics, when I look at who it's impacting the most, I think that's an alarm for us to be able to address that. And the needs of Black and Brown women are quite different than our counterparts in terms of access to health care, transportation, socioeconomic status, education. When you see those divides, then you have to keep the conversation going. Healthcare for all, when a small percentage is impacting the most. When you look at the deaths of women, Black and Brown women, that can be preventable with prevention, education, knowing their options like doulas, midwives, hospital. You have to say to yourself, it's not going to impact all, because it's impacting a population at a higher rate than others. And so when you have a higher rate of deaths, do you not say, well, we don't want to address that? You certainly have to. And when you have 5 representatives for the state of Connecticut and only 3 supports a bill that can bring access to healthcare, that's when you say there is a difference. When everyone could have signed the bill, we have Lawson and Hines who did not co-sign the Black Maternal Health Omnibus Act. If it's for all, then everyone should have signed co-signed the bill, and not just Johanna Hayes or Rosa DeLore or Joe Courtney. And so those are divides that's going to continue to happen if we don't all treat this as an issue that impacts this particular population, especially if you cannot hear them or you do not see them. So and until you see and hear them, then you can have a collaborative for all and healthcare for all. But until you see those disparities being the divides are not being inclusive, then I have to continue to say, yes, we still have to look at this population because they matter. And the healthcare of Black and Brown people is very important. And it shouldn't be in an epidemic proportion when we're one of the richest, the states. When we have rates of death comparable to nations that are not as rich with resources, that's a problem. I believe that is a problem. Thank you.
Thank you, Marva. Thank you for telling it is like it is. And with continuing with the telling like it is, Jennifer, may you please share?
Well, I think comparisons are distractions, right? So let's not be distracted. The facts are the facts. And so when people are sharing facts, it's just that. It's not a horrible thing. I think it's intentional and it's important and it's necessary to be pointed and intentional about targeted supports for people of color. We are a unique people, and we can't just be unique when it's a fact. We have unique experiences and unique needs, and so systems have to follow suit. I'll just end there.
All right. Comparisons, no. Facts, yes. All right. Thank you. And continuing to speak with the facts, Dr. Carla, your thoughts, please.
Thank you. I think that was a great place for me to jump in because I really agree with what Jennifer said. This is so from physician standpoint, practitioner standpoint, it's the science of medicine. This isn't about comparisons, it's about data. So everything that we do, we look at data when we're in science, and the data is how we come up with solutions, how we look at risks, how we decide how we're going to come up with solutions. So the numbers are telling you that there's an issue. And when you look at an issue in science and the data, you have to figure out how to come up with a solution. So if the data is telling us that this particular population of people are at risk, that they have risk factors, it is our responsibility to come up with solutions. So it doesn't matter what the color is, it does matter what the data is, and it can't be ignored.
All right now. Yes, yes, indeed. And I was going to say, if we're in church, we say amen. And so with that, we'll pass it to Dr. Cheryl, please.
I agree with what everyone has said. We have the numbers, we have the data, we have the information. What we also have is the bias. And the bias really dictates, I believe, right now, how we practice mental health, how we practice medicine. African American women of color are not provided the same alternatives. We're least likely to be offered evidence-based medication and therapy, and we're oftentimes, and I'm just going to share personally, I have a medical condition that's very common in Black women. And the first alternative they gave me was a hysterectomy. And I actually said, wait, hold on, what else do I have as options? And I had to ask the question and then do some research. So we're not always given all of the options. And that's really out of bias, not even out of science, but out of bias. And that's another factor that, if we take away the comparison, we address the bias and we address the facts and the numbers, we'd be moving in a different direction.
Absolutely. And so thankful that you used your voice to advocate for yourself, which unfortunately has to happen all too often. And so with that, Dr. Lenora, with your thoughts, please. And I will say, I know Dr. Lenora is wonderful. She's in motion, in action, and actually maybe right now attending to a patient. We're so kind that she was able to join us for this moment, but recognizing the pause and response, she may have been called out to do what she is to do. And so we thank her so much for multitasking and making herself available. But I imagine she would echo the sentiments that have already been shared. And so with that, let us continue on with the conversation. And this question as well is for all of you. What words of advice would you give little girls as young as 5 about the importance in taking care of their health? In the same way, so two-prong question, in the same way, what words of advice would you give more seasoned women about the importance of taking care of and advocating for their health? So before we go to that question, I see Dr. Lenora, but we'll come back to her. Again, oh, Dr. Lenora, you are wonderful. We called on you before, but imagine you were off attending to a patient and doing what doctors do. Do want to give you the opportunity. There was a question that we had. I'm going to go back to that question. And panelists, thank you for your flexibility. To hear your thoughts, Dr. Lenora, with respect to what are your thoughts regarding some who may question why comparisons between races are made and instead encourage focusing on appropriate health care for all women. And we heard some deep knowledge shared from the panelists here that really emphasize the importance of, well, look at the facts, look at the data. That speaks enough, but certainly want to give you an opportunity to respond.
Well, I think it's important to look at those things because often the inequity and the disparity is directly related to some of those things that I discussed before, not having equal access to things like um, well-resourced education, uh, good housing, um, jobs. All of those things can affect our health in general, and we need to look at those things. Also, it's important to note that there are others in other groups that may have similar circumstances, but yet the outcomes are much better. And we need to look at that so that we can understand the role that racism plays in creating or widening those disparities. So I think it is important to look at those things. While we are all equal, we are not the same. And as a consequence, sometimes we require different management, different treatments, and different approaches. Most of the healthcare providers that people are going to encounter, people like me, don't look like me. I have had patients come to see me who have never, ever, up until now, had a healthcare provider who looks like them. So I think because these disparities exist, we still need to scrutinize to find out, what other factors can contribute to our worse outcomes in these situations.
Well said. Well said, Dr. Lenore. Thank you so much. And with that, continuing to receive words of wisdom from you all, may you please share words of advice that you may give a little girl as young as 5 years old about the importance in taking care of their health. Again, we can never start too early, but may you also share words of advice that you would give a more seasoned woman about the importance of taking care of their health, as well as advocating for their health. And may we start with Dr. Carla, please.
Yes, thank you. I would say the advice is sort of similar, but maybe in different words, right? I would say to the 5-year-old or my 7-year-old, you are important, you are valuable, you are the center of your world, right? So that doesn't mean that you're more important than other people, but that means that you're responsible for making sure that your world turns, and it cannot turn if you do not take care of yourself. For her, maybe she's much like her mother. She tends to be very independent. And I see that she sort of wants to do everything and take on the world. So I thought that something very important was said to make sure for her to know that she doesn't have to do everything and that she can always ask for help. She will not. I am not sure if she was just born that way, if it's genetic, if it's nurture or nature, but it's really important. And I try to remind her to know that is also good health, and that is also taking care of yourself. So I would say, ask for help. You can't take care of other people if you don't take care of yourself. And nothing's going to continue if you're not healthy, right? Your world won't turn. So I want you to fly. I want you to grow wings. I want you to know that you are valued, that you are important. And I would say that also to the mature woman. I want you to know that you are valued, that you are important. I want you to grow wings. I want you to ask for help. And if you're not healthy, then you can't have a healthy world around you. And my most important thing, people, someone was asking me, like, what would you, my son, he's 15. What are you going to tell him? What do you want for him in this world? And so I only want one thing for him and myself and for everyone, is to have joy. So whatever it is that brings you joy is going to make you healthy. If that means you have to say yes to some things and maybe you have to say no to some things, then that's fine. I want you to have joy. They said, do you want him to have money? Do you want him to have a certain career? Do you want him to have a family? Whatever he wants, but I want him to have joy. And so that's what I would tell the 5-year-old, and that's what I would tell the mature woman.
Thank you, Dr. Carla. Joy, absolutely. And many other pieces you shared as well that we all can benefit from. Thank you. Dr. Cheryl.
Sister Carla, I agree. Joy is paramount. I am not a biological mother, but I am a non-traditional mother, raising a nephew, and I'm not sure what I'm doing with the nieces, but when they do ask me these questions, I tell them to make informed decisions because they are the most important person to themselves. Like they have to feel important enough to ask the questions, to say, no, I don't want to do that, and still be okay. The world may tell them something different. The world may tell them they're not enough. The world may tell them they're not beautiful, but they are. And I have to remind them oftentimes that it's okay to be beautiful in and of yourself and who you are. And don't be afraid to ask the questions. And if you don't get the answer you want, you might want to ask somebody else or make some adjustments. So that is the advice I often give is you are perfectly made and you are made perfect, and you have the right to ask the questions. You have the right to say no. You have the right to be beautiful in and of your own. Cocoon, your butterfly, spread your wings, do what you do. So that's the advice I would give.
And well received. Thank you so much, Dr. Cheryl. Marva, your thoughts, please. You're on mute, yes.
For the 5-year-old, I would say you matter. Your questions matter, and I want to hear it all. And for the seasoned ancestor with my elders, I would say you matter, and I want to hear all the questions, and I thank you. I'm a strong proponent of you have questions, I can give you facts and answers, and if we need to get a book to look at it and understand how it functions, let's do that. And I would just basically encourage the 5-year-old that, you know what, you matter, your body matters, your thoughts matter, and it's very important to have that voice and not to be afraid to ask those questions, whether it's tough or not. That I would do the best I can to give the support that they need in that moment. And as well for the seasoned individual, because they have had a journey and they've made it from a 5-year-old all the way up to where they are. And so I would love to hear how they thrive. And as the rest of the panelists say, just to encourage them and not to ascribe to what other people may say, that everyone will say what they want to say, but you have to stand firm, and be the best version of yourself that you could be. And that's kind of how I would approach the situation.
Thank you, Marva, and approached it well you have. Thank you. Continuing in that way, Jennifer, passing it to you, please.
Awesome. To respond to this question, I did lean in with my counterpart, Luz. And so I want to pull first from what she shared. She shared to take care of your heart. It's just as or more important than brushing your teeth or combing your hair. We have to be aware that we have to take care of our inner self as well as our outer self. So take care of your heart is the message from Luz. For myself, I'll remind us of our crowns. Straighten your crown, straighten your back. Be proud of who you are, and don't forget to straighten the other queens' crowns that are around you. So it's important to do that as well. So I'll leave it there.
You wear the crown quite well, Jennifer. Thank you. And let's pass the crown over to Dr. Lenora, please.
Thank you. So for the 5-year-old, I would tell the 5-year-old to be strong, to be curious, to be smart. I would let her know that she can grow up to be and do anything that she wants to be. Tell her to eat well, go outside and play. Do plenty of reading, do plenty of exploring. Put down your iPad, put down your tablet, and don't watch television. To the older, well, and also to that 5-year-old, I would want her to strive to also be kind and to be a blessing. And I think I would offer some of those same things to the seasoned woman, reminding that seasoned woman that self-care is not selfish, and that's something that she would need to concentrate on as well. And she can be strong, and she can be curious, and she can be smart, and she can play outside too. And she can eat well and get plenty of rest and put down her iPad or computer or her phone.
Thank you so much, Dr. Lenora. Thank all of you, not only in response to that question, but to all of the questions that you have responded to. You certainly have shared words of wisdom for us all, not only those of us who are more seasoned, but it's also important for the messages to be shared with the younger of young, the 5-year-olds, the 4-year-olds, and those on up, because learning is never too early to take place. And so I want to thank all of you so much for the words that you have shared and the importance of wanting to grow and have those wings to help you to fly and to have joy, the importance of being the center of your world. And to value yourself, to use your voice, to speak up, to speak out, to take care of your heart. Excuse me, to also remember to wear your crown. And I hope all of you remember the crowns that you have on you, those that are on the panel and those of you that are watching as well. It's important to remember all of that. And I also want to thank you so much again for speaking in a keep it real, candid kind of way. And although we talked about some deep measures, some deep things, some vulnerable, sensitive things, there's no shame in that. There's no shame in acknowledging where there are wounds and areas of growth. There is shame, though, in not wanting to do something about it or not wanting to recognize that it's there. And so thank you all so much for showing your strength in calling things out and recognizing where we have areas of growth. Thank you all so very much for your participation and for sharing your words of wisdom with us. Thank you, Dr. Cheryl. Thank you, Marva. Thank you, Dr. Carla, Dr. Lenora, and thank you, Jennifer. But we're not done yet with continuing to receive words of wisdom. Now going to pass the baton to Jennifer to introduce another key person.
Awesome. Thank you. And thank you, fellow panelists, for lending your voices. So we don't often get asked to share our birth stories. After we become mothers, we don't even often get asked how we're doing. People ask about them kids first, right? That's what happens. I asked a woman close to my heart to share one of her birth stories because it's one that should be shared. I asked Alzera Pitts, a beautiful mother of 3, to share the birth story of her second son, Khalil. Alzera, thank you. We hear you. We see you. We care. You took matters into your own hands and you gave voice to your health concerns and Khalil's.
Coming into it, the nurses was kind. They was coming in, they was talking to us. They was letting us know that his heart rate was going up and down. So they had attached some devices to him to check his heart rate. He had partial of his brain so weak. He had lost oxygen. And so they gave me a lot of diagnosis later on within the experience. I think they could have done more with coming to us and talking to us. Letting us know that we had the option to do like an emergency C-section, especially with him having his heart rate go down so many times throughout the birthing process. I think because we were young, they were like
kind of brushing us off a lot, just having us waiting and anticipating. Like, I had to advocate a lot myself. Like, I was scared at the time. I didn't know what to think of when having a child with special needs. So my son, his name is Fletcher Khalil Pitts. Everybody calls him Khalil. He's full of life, he's happy. When Khalil was born, he was 5 pounds, 14 ounces. So when he came in, he was meeting his milestones all the way up until probably like 2 months. So when he was 2 months, I was noticing he wasn't doing a lot of eye contact. He wasn't sitting up or moving his head up. But I was reading these books, and these books was telling you, and they would give you these books to where what stage your child's supposed to be, what they should be doing within 1 month or 2 months. And he wasn't doing any of that. So when birth to 3 came, they came in and they gave him a diagnosis of low muscle tone. So they kept doing therapy and PT and OT, but they'll come in and they'll say, if he walks, it might not be until he's like in his teens because he's really low tone. I'm just getting all these diagnoses one after another, one after another. Then I finally see the neurologist and it was like, okay, he has a diagnosis of cerebral palsy. But then I didn't get that diagnosis till after 2-3 years old, to where now I see, oh, okay, this was the cause of the seizures, this was the cause of the low tone, this is the cause of everything. So I was just thinking that I could have did things differently if they would have just, told me this diagnosis from early on in his stage. It's hard. And if you don't know the right words to say to get services for your child, it's not a book there. It's about talking to other mothers, other families who's dealing with it, helping them through the system, helping them get to programs to where it's programs really out there to help you, but they're not gonna come looking for you. You gotta come looking for them. You'll be around at PPTs and they're telling you, well, we only giving you 3 hours of direct services. I'm like, direct 3 hours? Like, that's not enough. We're gonna see him walk. We're gonna see him talk. By, I'll say about 3 years old, he started taking his first steps. And by 4 or 5 years old, he was already talking. He was telling us sentences. Moms out there, if people giving you diagnosis saying that your child will never walk, won't talk, don't give up on your child. Continue advocating, continue going, talking to doctors, knowing what's out there. Always advocate for your child.
And you'll see a theme, experiences that parents have really can change the trajectory of their careers. And this is the experience of our final speaker. SciHonor Devotion is a dedicated practitioner in reproductive health whose journey began 25 years ago with her own pregnancy experience, leading her to become a birth doula in 2001. She has since expanded her expertise to train and certify as a postpartum doula, childbirth educator, home birth, midwife assistant, certified lactation counselor, maternal child health specialist, and is also a doula trainer here in the state. SciHonor is currently a senior midwifery student who also actively contributes to advancing maternal health care by participating in several work groups and communities in the state. She is the founding director of Earth's Natural Touch, Birth Care and Beyond, and manages the Office of Early Childhood Doulas Network. So we thank you, SciHonor, for being here and preparing words as you bring life into this world, or support bringing life into this world.
Good afternoon, everyone. This is SciHonor Devotion from Earth's Natural Touch, Birth Care and Beyond. If you're watching this recording, that means that I was called away to attend a birth today and I couldn't be there in person to present. But I did want to participate and share with you what has been on my mind. So today we're going to talk about from tragedy to triumph, honoring the rights of Black women in maternal health care. Do you hear me? Do you see me? Do you even care? Following Black Maternal Health Week and contemplating the theme of today's event, I want us to acknowledge Lucy, Betsy, and Anarka, who did not have any control or autonomy over their own health care. They were 3 young women between the ages of 17 and 19 who were enslaved right here in this country during the 19th century. These young women endured painful, non-consensual, unmedicated medical experimentation led by Dr. J. Marion Sims. Their owners leased their bodies to Sims. Doctors of the time inspected and assessed the health of human property, particularly the reproductive potential of women, in order to guarantee that new slaves would be born. Because after all, they were not considered human. They were considered property. And it was believed that they did not feel pain the same way that everyone else did. Not only were they used however their owners saw fit, including for their own sexual pleasure, they were also expected to breed more and more and more slave children to ensure perpetual slavery and never-ending income for their owners. These young women had multiple unmedicated surgeries to repair their vaginal fistulas, which result from childbirth and sexual assault. In an effort to prevent waste from leaking into their vaginas, which made them unfit to work in the plantation house due to their smell, or to bear more enslaved children, they were operated on without their consent. They were held down by white doctors, nurses, and eventually even other enslaved women. Can you hear their screams? Can you see their pain? Do you even care? Recognizing healthcare's racist history is one key to dismantling institutionalized racism and enacting policies to safeguard Black women. Do you hear me? Do you see me? Do you care? What happened to Lucy, Betsy, and Anarka is just one example of the exploitation of Black women's bodies in medicine and the disregard of Black women's experiences with pain, mental well-being, and autonomy. This exploitation and disregard remains relevant to maternal health care disparities today. Here we are in 2024, and Black women's pain, mental well-being, and autonomy is still being ignored. As a result, we are suffering and dying. Far too often, Black women are not being heard. We're not being seen. We're not being cared for. Kara Johnson bled internally for 10 hours while her husband begged for medical assistance. He was told that his wife just wasn't a priority. She died. Here you see Shamani Makiba Gibson, Dr. Shalon Irving, who was an epidemiologist for the CDC, LaShonda Hazard, who was a Rhode Island resident right here in New England, Amber Rose Isaac, who lived in the Bronx, Christine Fields. All of their reported symptoms were ignored by those who were supposed to take care of them, and all of them died as a result. There is a reason why the CDC says that over 80% of maternal mortalities are preventable. Do you hear me? Do you see me? Do you care? Social and systemic shifts are vital to mitigate Black and maternal morbidity and mortality rates that are driven by racism, implicit and explicit biases, socioeconomic factors, and infrastructure deficiencies in healthcare. We are charged with giving voice to Black women's health and maternal health care. To drive change, we must acknowledge and learn from these historical and present-day traumatic events and take action to address racial inequalities, ensuring rights for Black women during the perinatal year and over the entire course of their lives. This perinatal Bill of Rights for Black families was created to help us all contribute to making necessary changes. These changes start with self, which is why we have included reflection questions that can be used for personal reflection or even group discussion. Please feel free to use, share, and discuss them. This document can be emailed to you. The rights of Black families stand as a fundamental cornerstone in fostering an inclusive and respectful environment during the transformative journey of pregnancy, childbirth, and the postpartum period. The principles of respect, dignity, and cultural sensitivity underscore the essence of these rights. As Black families embark on this profound experience, we assert our rights to autonomy, equitable care, and an environment that acknowledges our unique needs and challenges. From the rights of pregnant individuals and their partners to the demand for a comprehensive, culturally aligned care system, the following principles elucidate the core rights that Black families deserve, setting the stage for a healthcare paradigm rooted in anti-racism, empathy, cultural humility, and eliminating racial disparities in birth and neonatal outcomes. These topics are included in the Perinatal Bill of Rights for Black families and emphasize that Black families should be treated with respect, dignity, and cultural sensitivity throughout pregnancy and childbirth, regardless of their circumstances, traditions, or beliefs. This extends to the support team and includes incarcerated individuals, persons with disabilities, and marginalized communities. Fathers and partners have the right to inclusive support and involvement in the perinatal process, including participation in prenatal appointments and decision-making. Freedom from discrimination is crucial and ensures equitable healthcare for Black families. We have the right to be listened to, evaluated, and to receive timely treatment without being ignored or accused of exaggeration. Black families should have autonomy over pregnancy management decisions, including access to comprehensive information about reproductive healthcare options. A supportive and inclusive birth environment is essential, allowing families to choose their preferred birth setting, whether that be home, hospital, or birth center, and their support team, including having traditional midwives, certified professional midwives, and doulas. Access to postpartum support, comprehensive care, adoption planning, and grief and loss support are all also very necessary. Black families should have access to perinatal community support and culturally aligned care to help address the disparities that we see today. Transparency, informed decision-making, autonomy, and consent are extremely important, along with equitable and affordable access to quality care. Healthcare providers should practice structural and historical humility, recognizing the impact of historical and present-day racism on health outcomes. Black families also have the right to privacy, accurate records, transparent billing, and the ability to file grievances and share their personal stories. Ultimately, addressing maternal health disparities in Black communities requires sustained effort, collaboration, and a commitment to dismantling systemic barriers from all of us to ensure that Black families not only survive childbirth, but also thrive in all aspects of life. Devaluation of Black lives must end. It starts with us, right here, today, right now. We are charged with giving voice to Black women's health and maternal health care. Our doulas play a crucial role in supporting the health of Black women through advocacy and support, ensuring that our clients' voices are heard and acknowledged, encouraging informed decision-making, providing culturally sensitive care, recognizing and addressing racist practices, educating clients so that they can feel prepared to make informed healthcare decisions for their families, mitigating the effects of racism and trauma with non-judgmental emotional support, preparing them for less interventions at birth, and being the extra eyes and ears during the pregnancy and postpartum period. I can't even tell you how many times we've had clients who have experienced obstetric violence by their medical providers, such as being held down, like Lucy, Betsy, and Anarcha were, threatened by their care providers, having experiences and conditions that could have killed them ignored, and are made to feel dehumanized. We are far from the 19th century, but we are not that far from the 19th century, if you know what I mean. We have a very long way to go. Lifting Black women will allow all women to be raised. As we come to a close today, I ask that you now please take a moment to ponder on the things that you have heard, your insights, your feelings, the implications of all of the information that you've heard today, so that it may deepen your understanding, provoke thoughtful conversations, and inspire meaningful actions. How will you use the information that you heard today to reflect on your own biases? How will you use the information that you heard today to ensure that Black families get the care and support that we deserve? How will you use the information that you heard today to inform those who couldn't be here today about the historical and present day treatment of Black families in healthcare? Do you hear me? Do you see me? Do you even care? Earth's Natural Touch Birth Care and Beyond is the largest Black-owned doula training organization and collective in New England, with doulas all across our state of Connecticut and in other states who work to reduce the risk of undesirable pregnancy and birth outcomes, promote perinatal wellness for parents and children, and support breastfeeding advocacy for all families, while also working to eliminate racial and ethnic disparities in infant and maternal health within undervalued, underrepresented, and historically excluded communities. Many of our doulas are members of the OEC's Doula Network. Some of our graduates or current students may be on this call today. If so, I want to give them a shout out. Thank you for allowing us to manage the OEC's Doula Network and to train more and more home visitors to enhance their family support skills. You all will be getting the Perinatal Bill of Rights for Black families to use as you see fit. If you want to get it before we email it out to you, or if you just want to send other people to the source, you can go to our website, ENT or earthsnaturaltouch.com. You can find us on Facebook and also on Instagram. I hope you all are well. I know today was probably kind of heavy, but I hope that it was also inspiring and motivating. And you're leaving this with a sense of urgency to go back to your communities, go back to your jobs, go back to your people, go back to your coworkers, go back to your communities, your families, anybody that you can touch, to use the information that you gained today to start making change. We are far from the 19th century, but we are not far from the 19th century. Take care, everybody.
My, oh my. SciHonor, thank you so very much for your powerful, inspiring words. As SciHonor shared, her intentions were to be with us today, but she's doing what she is blessed to do. She's helping to bring life in this world at this time. So we do pray that the family is well and the new baby is well and all is well. Thank you so much again, SciHonor, for all that you do. And thank all of you that have been a part of this webinar. Again, the theme was, do you hear me? Do you see me? Do you care? And this was an important topic that's not just for today, but one that we certainly want to continue moving forward. Thank you so much, Diana, for beginning us off with giving the instructions on interpretive services. Thank you, Diana, and thank you to our interpreters, Rhonda and Amy. Thank you very much. Thank you so much, Deputy Commissioner Elena Trueworthy, for your ongoing constant support of all the things that we are striving to do. And to our powerful keynote speaker, Ayesha Clarke, thank you for your powerful words informing us and giving us a charge of what we need to do. Thank you very much, Shaquita Lockley, for your documentary, Eggs Over Easy. Thank you for bringing it to light on a national level, a worldwide level of this important topic. Thank you for our wonderful panelists, Dr. Lenora Williams, Dr. Carla Gunn Sampson, Marva Malone-Lyles, Dr. Cheryl Ellis, and Jennifer Wilder. Thank you all so much for collectively sharing words of insight for us all in a very keep it real, honest, genuine, but impactful way. Thank you so very much. We also thank Azira for her story, sharing what she went through, but also what how she is continuing to thrive, both she and her son. Thank you so much for sharing your story. And once again, to our closing message speaker, SciHonor Devotion, thank you so much for your powerful and insightful words. And of course, want to thank all of you that are viewing this. Thank you for taking the time out of your busy days and schedules to listen, to be a part of this. There are many who may choose not to listen to what has been shared, but that's not going to help us to move forward. And as uncomfortable as the conversation may be, we must have the uncomfortable conversation so we can grow and learn from that. And I'm going to share the words of James Baldwin, who once said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." Thank you all for your time, your attention, and facing this important topic with us. And with that, let us move on and let us take action. Thank you all so much.